Well, thanks for joining us for this episode of DCCares. This is part of a series that we are doing for caregivers of loved ones who are dealing with dementia, Alzheimer's, or other forms. And today I have a special guest, Dr. David Rogers. And David, I discovered something that I really should be more careful to inform guests about. I believe I said podcast, and people often think with podcast that it's just audio.
Right.
But of course, this is video. And I love your shorts. But I realize I should have told you that you're going to be on camera. So
apologies ahead of time. So thank you.
Absolutely. You have quite a lot of history in geriatric medicine, don't you?
Yes.
Tell me a bit about that.
Yes. So when I was a resident, I said I would never really want to take care of older people. And that was, I was very excited. I was doing OB, I was doing pediatrics, all sorts of things. But with that practice also is patients. And as they get older, you become more and more of a geriatrician. At the practice I was at, the patients realized that there was a group of physicians who never left the office. That was the faculty, and they tended to migrate. So the faculty over time ended up having quite an elderly population, all the older, wiser patients who figured out the system. So I ended up, in spite of myself, doing a lot of geriatrics. So I have learned to enjoy it. Of course, I am joining that group now as a geriatric person. So, and then here at SQUIM, people told me that the population was a little bit older, and I said, well, we'll wait and see. And then, when we came, it was true. So yes, it's been very interesting.
It's true. Mm-hmm. And congratulations to you. Speaking of joining the geriatric set, you have fully retired this year, haven't you?
Fully retired last month, yes.
All right. Well, congratulations on that.
Thank you.
Let's talk for a bit about, maybe go back to the very beginning. Thinking about someone who their loved one doesn't yet have a diagnosis, but they're seeing some things that it's making them wonder if maybe something's going on. What are the indicators that they might say we need to check into this further?
So all of us, as we get older, will have just sort of normal aging of the brain. And what that's felt to look like most of the time is just a slowing down of how quickly we can access information. So that if a person can't remember a name at a critical point, or can't remember some bit of data or a word, later on, if that word comes to them, that's actually supposed to be a pretty good sign that everything is still connecting and we have normal function here. When people start losing some of that ability to find words, having more problems with word finding, name finding, those are of concern. But those can be normal brain aging. If we start to lose some geographic, some ideas about navigation, or losing place, losing important items, valuable items, those are more concerning, but this is all on a spectrum. So even the person, what I would say is, if it comes to you, or if that word comes back to the person or that name, it's probably normal aging brain. But this is all, again, on a continuum, so that at one end we have the dementias, which are problems with the brain that cause a difficulty with daily function. Over here is normal, whatever normal is. And then there's even a group sort of in between. It's called mild cognitive impairment, MCI. And these people, they're having some difficulties, some fixed difficulties with their thinking, but it's not affecting their day-to-day living. So they don't really fall into a dementia category. This group will not necessarily go on into a dementia category. And actually, sometimes the people that are in this group improve and go back into normal by testing. So I would say if we're seeing a pattern of continued mishaps with words or other things, or missing items, if there's any question about danger or with driving and some of the more advanced or more executive skills, then it's probably worthwhile talking to a primary care provider about it. So there's actually fairly simple memory testing that we can do in the office that can't take more than 5 or 10 minutes. It's very well validated, very well studied, and it can sort of help us understand what's going on. I've had family members, family bring in patients, and we do the testing, and they're sometimes flabbergasted at how well the patient does. They pull up these things on this test. It's like, well, you scored normally today, or you scored in a very, very minimal dysfunction area, and that can be reassuring. It's like, oh my gosh, I don't have Alzheimer's. This is wonderful.
Yeah.
On the other hand, we may test somebody, and sometimes I think I know what the result will be, but I'll go through the testing because I think the family doesn't have a clue. The caregivers, the soon-to-be caregivers, don't realize that there is as much of an issue. So we'll do the testing there in the office, very simple questions, and then we have an answer right there, and it just sort of at least gives us a general ballpark of where somebody's
You know where you're at. What do you say to that caregiver at the point where they get that diagnosis? Because I imagine that is pretty unsettling when someone says to you real clearly, here's what's going on. What would you say to them at that point?
So if it's the mild cognitive impairment, I would say that this is common for many of us as we get older, and this can improve. This doesn't mean that this person will go on to a dementia if I'm talking to the caregiver. If the person falls lower in their scores and they're falling into maybe the very first area or first line of the first section of maybe dementia score, then we'll do more questions. We'll actually do more investigation to make sure we're not overlooking another medical problem that would be simply treated, like a low thyroid or an undiscovered diabetes or something like that. And that can sometimes make us not function well or not do well. I'd also say that dementia just means memory loss that is affecting day-to-day living and ability to function. So it is not a specific diagnosis. So Alzheimer's dementia is a form of dementia under the umbrella of all of the dementias. So it is one kind. It is the most common kind in the U.S. It's probably 60 or 70%. But depending on the diagnosis depends on what the course might take. An Alzheimer's dementia is usually a very slowly progressive dementia that may take years to progress on to more severe stages. But also I will emphasize that we do need to look at other things and make sure we're not missing anything else. And so I don't just say, you've got dementia, good luck. It's like, no, we're finding something here on testing. If there's some question about where we're falling in this, we can get some more sophisticated neuropsychiatric testing that takes a pretty significant amount of time, 4 to 6 hours. It's not available immediately. It's more like Silverdale or Poulsbo. But most of the time, just to sort of do that initial evaluation, here's where we're falling with this, it can be done in primary care office.
Okay. And I'm assuming in terms of the progression of any disease in that dementia umbrella, there isn't really a norm in terms of progression. The timeline, the phases of it, I imagine that varies widely from patient to patient, doesn't it?
Very much so. And just looking at the American Alzheimer's Association website, they talk about sort of mild, moderate, and severe stages. And the mild, they give that as months to years. And then they say that the moderate stage, where we're seeing more impact on day-to-day living, day-to-day functioning, that one, they give that one often as years, because that is a slow progression. And then the more severe is often weeks to months.
Okay.
Just to back up, often though, families or patients don't quite recognize something's going on, so we don't identify an Alzheimer's or any kind of dementia early. And sometimes, well, it's just mom, she's getting forgetful, and she puts the keys in their freezer, so is that a big deal? Well, maybe that needs to be looked into. Reason is treatment early does seem to help slow progression.
Yeah. Something that I have seen numerous times is a spouse, I think generally a spouse, because they'll be about the same age, so you have an older spouse,
Yes.
caring for their partner.
Yes.
And And of course, because this is a gradual progression, what starts off as a very manageable caretaking task becomes more and more involved and more demanding.
Yes.
And you see people, I'm sure you've seen it, where they really have, it's more than they can handle. But they're not even recognizing themselves the toll that it's taking. Is there anything that you would give people by way of some road signs to say, you may be at a point where you really need to find more help with your loved one?
Often, if it's a first time I'm meeting somebody, they're coming in and they may or may not have a diagnosis, but I'm trying to get an impression of what's going on, and many times they are overwhelmed. And in the doctor's office, they may be able to drop that brave front and sort of say, here's what's going on. Some won't, and they'll put on the brave front. So then I'll start to ask questions about, how is the caregiver doing? How are you doing? What are you doing for yourself? What are you doing for self-care? Are you getting time on your own? Are you getting some time away to decompress? What are you doing about that? How do you do shopping? How do you do these things? And it usually becomes apparent, I think, for what you're describing, that they've sort of been doing everything on their own. And then I'll ask about family members and other resources, and they may or may not have adult children in the area, and it may be the adult children aren't even really fully aware of what's going on. Or it's benign, okay, things are working out, we're busy, we have kids, so mom's still being able to take care of dad, if that's the scenario here, and so it's all good, and nobody really wants to look too much harder. But yes, it can fall on the caregiver, but it shouldn't. None of us can really do this alone. So sometimes it will sort of insidiously sneak up on the caregiver, and suddenly they are overwhelmed. I've seen some people, caregivers, who come in and they are depressed or very anxious, and it's like, I can't quite understand why. I know that they have a family, a spouse at home who's struggling, but I've never met the spouse. So then it's like, well, let's explore a little bit more. Tell me what your day's like. And if the day is entirely taken up surrounding taking care of that person who's struggling, then it's like, okay, sounds like this caregiver is near the breaking point. So I would say the caregiver may, as you mentioned, not recognize what's going on, or it's just sort of boiled and it's continued to grow and grow and grow. And depending on generation or even resources that are available, family members, they may not call on help. They may not even recognize their need for help. But this is something I've told many people, this is like a marathon. This is not a sprint. This is a marathon, and we need to settle in for the long term on this. That's not to be a threat. It's just that we need to actually plan for sort of long-term thinking, long-term care. Let's get some help for you, some relief for you. Now, where are you with your finances? I'm not a financier, but it's like, have we talked about that? Do you have something in place? Do you all have advanced directives? Where are we even in the beginning on this? So there's some very basic things that if this is snuck up on them, they might not be even aware that they need to do these things.
Yeah, good. A book that, a couple books that I've found, I think you found one as well. There's one here by Thomas Harrison and Brent Forrester called The Complete Family Guide to Dementia. And this is one resource out there that may be helpful to people, I think. There's another one that I loaned my copy out to someone, but it's a book called Between Life and Death, a gospel-centered guide to end-of-life medical care by Dr. Catherine Butler. And I found it a very practical. She writes as a believer, but also as a very experienced emergency medicine doctor who has dealt with lots of geriatric cases. And so some really good information there as well.
Right.
And then there are a number of online resources. You've given me some things to scan that I think we're going to link to along with this podcast for people so they can get access to that. Well, thank you very much for taking some time, David, and congratulations again on your own retirement.
Thank you, Pastor.
So, all right. Well, I hope this has been helpful and that you'll join us for another episode of DC Cares. So, David, how many people, I guess when you talk about people going through dementia, how many people are being cared for privately by family, friends, versus people that are actually in nursing care?
Right. So I mean, I think most of us think about people being in nursing care or some kind of facility, but American Alzheimer's Association says that probably 80% of adults who are requiring long-term care are having that done at home. The other statistic is about 90% of that is being done by family members. So a point of that, I think, is that we're not alone. This is happening to many of us. It's affected many families. So you're not alone in this, but we also have to have resources for these people because this is a real issue.
And also, to me, says that it's important if someone is going through this, while there is a certain stigma, I think we all feel, we hate to admit that a loved one is going through that kind of decline, to be willing to talk about, to let people know what's going on, then allows you to get connect with other people who really do understand, who have been farther down the journey, and can just help encourage and support you.
Right. I think that's some of the support groups that are available in the area. I think that's one of the advantages of being involved in a support group is you can meet with other people who have been down this road. They can usually be there. Usually if they're involved in it, they want to give you information they wish they had. They're usually very encouraging. So you can find out you're not alone, but actually it's pretty common.
Yeah.
And I have met some people where family members are doing some amazing things, taking care of their family members. It's just, we have to do it. Mom and Dad, they took care of me. I take care of them. But we're not in this alone.
Yeah.